Hello everyone, welcome to this topic. Okay, in this video, I will talk about the hypertension. Maybe I will talk also about the fact, number, and then the guidelines about the hypertension. Before we start talk about hypertension, I want to introduce myself. In this topic, I want to talk to you about the definition and classification of hypertension, prevalence, etiology, pathophysiology, sign and symptom, risk factor, and of course the management of therapy. Okay, let's to the first subtopic. Yeah. Okay, this is the definition about hypertension. I take a definition from the WHO and then from the AHA. AHA, it's mean American Heart Association. If we see from the WHO, hypertension, also known as high or raised blood pressure, is a condition in which the blood vessels have persistently raised pressure. Okay, and then from the AHA, high blood pressure or hypertension is when your blood pressure, the force of your blood pushing against the walls of your blood vessel is consistently too high. From these two definitions, we can see the bold font. The keyword from the hypertension is the condition if any persistently rise pressure in the blood vessel. So the blood will flow in the blood vessel is caused by any pressure from the vessel. Yeah, some force from the blood vessel. Yeah, the hypertension is condition when the force from the blood vessel consistently too high. Yeah, that's some condition in the hypertension. So why the blood vessel have consistently high the force, or why the pressure from the blood vessel persistently rise? Yeah, we can know in the pathophysiology. But before talk about the pathophysiology, let's see the classification. Yeah, this is the classification from blood pressure, and also we can see the classification from the hypertension. Yeah, for normal person actually have both types of the blood pressure, any systolic and diastolic. For normal person, the systolic around about 80 until 120, and then for the diastolic range from 60 until 80. Yeah, this is for normal person. And then this any condition pre-hypertension, this mean more than normal criteria, but not apa ya, not reach the hypertension. Okay, for the pre-hypertension range between 120 until 139, and then from the diastolic between 80 until 89. Yeah, and then if someone have the blood pressure for systolic more than start from 140, I mean, yeah, start from 140, or not n but or the diastolic start from 90. Yeah, that's mean the person already got hypertension. Yeah, hypertension stage 1. If the systolic below 159 or the diastolic below 99. Okay, and then after hypertension stage 1, any hypertension stage 2, yeah, between start from 160 or higher, and for the systolic, and then for diastolic start from 100 or higher, and then if more than 180, yeah, it's called emergency. Yeah. High blood pressure crisis and have to take to the emergency. Okay, beside classification from the hypertension, there's any type of hypertension. The first one is primary hypertension, and then the second one is secondary hypertension. For the primary hypertension, the condition is mean high blood pressure that is not related to another medical condition. So why I put the icon no, that's mean no correlation with other medical condition. Different with secondary, because the secondary hypertension, another medical condition that causes high blood pressure. So the hypertension condition is caused by another condition. For example, caused by kidney disease, or maybe some problem with the arteries, or maybe some problem with heart, for example, like any heart disease, or some problem in the endocrine system. Yeah, there's problem can build the high blood pressure, so there's we can call secondary hypertension. Okay, this is the prevalence for the hypertension. This is the prevalence in Indonesia. Yeah, in Indonesia, from the age more than 18, yeah, it's can call adult. In Indonesia, the prevalence average in 34.1%. Yeah, and then the province most higher prevalence is this is ya Kalsel. Kalsel is mean Kalimantan Selatan. Yeah, the orange color is the data from 2018. Yeah. Okay, this is information from the WHO. Yeah, 31.1% of adults, or maybe 1.39 billion in the worldwide, had hypertension in 2010. Yeah, I tried to search the data in nowadays, but I just find in 2010. And then from this data, the prevalence of hypertension among adults was higher in L LMICs. This mean low income countries, yeah, than in high income countries. Yeah, maybe some risk factor from the low income countries, yeah, can cause by food, maybe, yeah, and then can cause by stress, because apa ya, the payment, maybe the payment from the people in low income countries not enough maybe ya for the life, and then can apa ya, can induce the stress, and then can the finally can induce the hypertension. Okay, this is the etiology from the hypertension. The etiology based on the type, the type of hypertension, any type, primary type, and then the secondary type. For the primary type, the etiology is unknown, and almost people have diagnosed hypertension, there's classified to primary hypertension. Yeah, maybe around 90% from the hypertension people, there's a primary hypertension. And maybe the etiology from the primary hypertension is caused by genetic. Okay, and then for the secondary hypertension, around about 10% from all people have diagnosed hypertension. And then in the secondary hypertension, hypertension is comorbid by the other disease. I mentioned before in the type, for example, caused by kidney disease, or maybe diabetic disease, or maybe the other disease, like dyslipidemia and heart disease. And from the secondary etiology, can cause also by drug, some drug induced hypertension. You can see in the table in the left, there's some disease can cause hypertension. For example, kidney disease, adrenal gland tumor, thyroid disease, congenital blood vessel disorder, alcohol abuse or chronic alcohol use also can cause hypertension and obstructive sleep apnea. And then in the right column, there are some drugs and other product that can cause hypertension. For example, like NSAID. But NSAID, I think in long using, or chronic use, and then also birth control pills, for contraceptive pills can cause hypertension. Maybe the right word maybe can induce hypertension. And also the congestan, cocaine, amphetamine, corticosteroid, some food also, for example, like in sodium, enriched sodium, and then alcohol.